let's look at the recommended practices and barriers in biosafety level. I have taken this table from the guidelines of the WHO, and this is a summary of it. When I am talking about these levels, please understand that this is only a guidance and this is not a Bible to say that this is the only thing which has to be done. For any facility to decide what kind of primary barriers or secondary barriers need to be applied, one needs to carry out a risk assessment, which we'll talk about when we go to the facility design, and make sure that we do a risk assessment and then apply the physical containment means. So when we talk about BSL-1, these are not going to cause diseases because these are generally safe. The standard practices which have to be followed are those good microbiological practices. There are no primary barriers required. PPE can be worn on a need basis, and generally on a facility aspect also a regular laboratory bench and a sink could suffice the need. When it comes to biosafety level 2, then there is a possibility of a moderate infection, and therefore we have to, apart from following good standard microbiological practices, limit the access to these work areas from the general access which is available, have the biohazard warning signs, and of course take care of having a written down protocol and procedures with respect to usages of sharps, because one of the routes of infection is when the sharps are used, you could prick yourself or you could have a cut on your skin and get infected, and this is more for the workers. So these are the practices which need to be introduced. Insofar as the primary barriers are concerned, we need to use biosafety cabinets. We need to use equipment with safety systems like centrifuge, safety cups, and of course, ensure that any manipulation which is being done, we do not use systems like mouth pipetting and stuff like that. So these are the primary barriers. PPE remain there on a need basis based on the risk assessment. And when we come to the risk assessment and the hierarchy of control, I would like to bring in the difference of what kind of PPE should be used in the facilities and how important is PPE as a control mechanism. Apart from the BSL-1 facility that we've used, we are going to use the BSE cabinets. For a BSL-2 facility, it is ideal to have the autoclave within the premises. It is not necessary to have this within the lab, but it is good to have an autoclave nearby so that decontamination can be done. When it comes to BSL-3 facilities, then it is very much necessary that the access is totally controlled. The decontamination of all the waste which gets generated in the workplace and within the laboratory or the work area needs to be done, and decontamination of laboratory clothing is a must-have. So you cannot go in with contaminated clothes. So there is normally a change even on the street garments before you go inside a lab, and whatever garments or the protective clothing that is worn inside the lab needs to get decontaminated before it is reused after a laundry. Insofar as the primary barriers are concerned, biosafety cabinets are a must-have. No open manipulations are permitted, and the PPE, in terms of having proper gloves, face and eye mask, respiratory protection if necessary, has to be introduced. In terms of secondary barriers, there has to be necessarily a physical separation of these such laboratories from the rest of the areas. There should be interlocking doors which are there in the laboratories. The laboratory is at a negative pressure, which means that the air does not flow out of the laboratory into the surrounding areas, but the surrounding areas send air into it. Now, this is a little bit of a debatable topic from only one perspective, that the exit airlocks, the airlocks through which the people go out or the material go out, also need to be negative, and sometimes they need to be more negative as compared to the laboratory. But this again is an output from a risk assessment. Entry into the lab is only through airlocks and entry rooms, and then there has to be a necessarily decontamination in terms of hands or whatever is used while handling the biohazard. When it comes to BSL-4, it is very much necessary that the clothing gets changed before entering. Now, this is a practice which we have introduced even in BSL-3 because we do not want contamination of the garments which people wear when they move out of the laboratory. So it is standard practice even to do a clothing change in BSL-3. Shower on exit is a must-have, and all material has to get decontaminated, whether be it clothing, be it equipment, be it any waste material, everything needs to get decontaminated. From a primary barrier perspective, BSE cabinets class 3 are preferred on a BSL lab 4. Sometimes BSL2 cabinets can also be used, but again, dependent on risk assessment. In so far as the secondary barriers are concerned, ideally BSL4 facilities are a separate building, generally not an isolated zone, but a separate building within a premises. There has to be a dedicated supply and exhaust systems. The HVAC systems are completely disconnected from the rest of the facility. And then, of course, there are many other practices which are done based on risk assessment. When it comes to treating a BSL-3 and a BSL-4 facility, it is always ideal to make sure that the BSL-3 facility follows a lot of the secondary barriers that we insist for BSL-4. The reason being that we are dealing with exotic and dangerous microorganisms, even at BSL-3 levels at times, and it is ideal not to compromise on some of these secondary barrier systems. What are these labs used for? BSL-1 are used for general teaching and research purposes. BSL-2 is used for primary health, diagnostic services, and research again. When it comes to BSL-3 and 4, we are dealing with high-end pathogenic substances, and therefore special diagnostic service or research gets carried out in BSL-3 and 4 kind of facilities. So these are the physical barriers which are recommended. And when I say these are recommended, please, I would like to underline here that it is not the only thing which has to be done.